Well, good morning or good afternoon for whatever time you're watching it. Today is Wednesday, March 25th, 2020, and I'm back here with Dr. Rocco, our superintendent of the Hamilton Township School District, and Kathleen Fitzgerald, our director of Health, Recreation, and Senior Services. Last Wednesday, the three of us had done a video, thanks to the cooperation of WBCB 1490 AM. We got great feedback on that video, which was an opportunity for us to speak to you directly about what's going on in our township, what's going on in our schools as it relates to our collaborative response to COVID-19. Today we wanted to try a different medium to present you a video response on the updates that we've had over the last week. So we're here today at the Hamilton Township School District boardroom to tape a video, again, of what's happened over the last week, where we see things going now after a new week of information, and give it an opportunity for us to speak to you all directly on what's going on here in town. So I want to thank Dr. Rocco and the school district for providing us a venue to be able to speak to you all. My understanding is this video will be posted on the channel such that everybody will have the opportunity to view it, and obviously we'll do our best to get it on social media and websites as well, so we can get it sent out to as many people as possible, because this is really an opportunity for us to speak to you directly about what's going on and about our response here in town. So I want to start, as I did last time, with an update on where we currently stand in Hamilton Township. So last Wednesday, when we did our video through WBCB, I announced the first 2 positive cases that we had in Hamilton Township. This morning, I was informed that Hamilton Township is now up to 12 positive cases. The age ranges of those individuals are from 22 years old all the way up to 91 years old. And all those individuals are either isolated at home or at the hospital. Our health staff has done a tremendous job under Kathy's leadership. They are tasked with doing direct contact screenings. So once an individual tests positive, we get a list through the health department of every individual that person was in direct contact with. That direct contact is a specifically defined term. It means that for at least 10 minutes, you had direct contact with this person within a distance of under 6 feet. So if you don't meet that criteria of having at least 10 minutes of contact for a period of under 6 minutes within a certain time frame of days since they tested positive, you are not deemed a direct contact. But everybody who is deemed a direct contact, our health department has to reach out to and contact and screen them to let them know that they were a direct contact, to get an update on whether they're having any signs or symptoms, and to give them guidance on what to do moving forward. Our health department is working around the clock as we see an increase in positive tests to be able to do all those direct contacts. So what that means is if you're not contacted, that you are not a direct contact with somebody who's tested positive. As you see, since last Wednesday, when we had 2 tests, we're up to 12 now. We are going to continue to see increases like that, and maybe even larger. That's due in part to 2 reasons. The first being more people are being tested. Hopefully starting this week, we're going to collaborate with Robert Wood Johnson to get our first responders in town tested. They are on the front lines of this. They are working around the clock to help all of us, not only in their daily responsibilities, but obviously they occasionally get calls from people who may have the COVID-19 virus. So we want to make sure those individuals are tested and are tested regularly, and we hope to do that. So obviously, the more people who are tested, the higher numbers we're going to see. The second part is the community spread. There are lots of people who are walking around who are asymptomatic, not even knowing that they have the COVID-19 virus. Through that, they are passing it along to others unwittingly, unknowingly, and you get spread that way. So we will continue to see an increase in numbers, not just here in Hamilton, but in Mercer County, the state, and the country because of those two reasons. Again, the more people that get tested, it's a good thing. It allows our professionals up at the state to look for patterns, to see if there are more hotspots, as we've seen in New York City and the surrounding areas around New York City, and to be able to provide feedback to local health officials on whether more contacts need to be made. So I appreciate all the help, again, of Robert Wood Johnson, our area medical professionals, and our health department in responding to that. So again, that's our update as of today on where we stand. We'll get into some of the questions that we've been getting from you, the residents, here in a little bit. But at this moment, I'd like to introduce Dr. Rocco.
Good morning, Mayor and Kathy. Good morning. And thank you very much for doing this again for our community. There are a few things I want to start with, and then we can go into some more detail later on in the video. I want to give thank yous out to our faculty and staff, our students, our parents, our Board of Education, the community, and the Township. Mayor, you and everybody at the Township. The work that we've been able to do together has been a true team effort, and I want to thank everybody for that. We've really come together as an example of one Hamilton, and I appreciate the work that's being done by so many people. We are in week 2 of remote learning in our school district, and as I said on the last video, if you told me a month and a half ago we were going to do this, I'd say no way, but we've actually done it. To enhance the ability of our students to work online, we handed out over the last 2 days an additional 988 Chromebooks to students, and those are on loan to our students, which raises our online capabilities for students to 96% of our students at this point. The numbers are not totaled yet. 988 was as of last night, and they're still counting. So we could be upwards of 97 to 98% of our students online. That's a over 10% increase from the previous week. So we expect remote learning to continue through the week of April 13th. The prior week is actually spring break, so there will be no remote learning on the week of spring break. I just want people to know that. Yesterday, we also had food distribution at our 6 sites. I'm actually excited to announce that we were able to distribute food to over 2,500 students for the next 2 weeks. And that is a team effort. Our food service personnel were there, our volunteers were there, our faculty was there, our administrators were there. It was a total team effort distributing food at those 6 sites. There will be no food distribution the week of April 13th, but we will provide the week of spring break. Our food distribution will return the week of April 13th, and we'll provide more detail in our newsletters. And then two items I want to kind of close with in this segment is about testing. There's a lot of anxiety with the students about standardized testing and AP testing. So 2 things that came down. Late last night, the state informed us that their waiver for state testing, standardized testing, was accepted by the federal government. There will be no state standardized testing this year. So that should reduce some of the anxiety that's out there. And then the other is with our advanced placement students. And so we have juniors and seniors that take advanced placement classes. They then take the test, and if they score a 3 or higher, they get college credit. And this is important to our students, very important to our students. And so a College Board who runs the advanced placement testing has let us know that the AP testing will go on. It will not be the traditional testing. It will be individualized with the students. But the other part of this is that the AP program through College Board is offering free sessions online. And all of our AP students should look for an email from the Office of Curriculum and Instruction outlining a lot of that detail. And as more of that detail comes out, we'll provide that to our students. But I think that's really good news for our AP students so that they can continue on getting their college credits.
That's awesome. Thanks, Dr. Rocco. For the 4% who aren't remote, what do they have to do to still get their education?
So actually, as we speak right now, there are packets being mailed to the students who do not have a device or Wi-Fi, and they will receive that in the mail in the next 2 to 3 days. So 100% of our students will have work available for the next 2 weeks.
Awesome. And then what about, I know you talked about testing, what about like SAT testing if you were a junior or senior thinking of taking a SAT test soon?
Sure. The SATs right now are canceled at this point, and we'll keep an eye on that website to see when they're going to reschedule those. I would suspect they would offer something in June and maybe even July.
So Dr. Rocco, thanks for that information. Do you have any other information that you'd like to share with the parents at this time?
Sure. I have a couple other items. One of the biggest questions that we've had recently is about proms, sports, graduations, and other important events. And there's a lot of special events that happen in a student's life, especially when you are changing schools, 5th to 6th, 8th to 9th, and our seniors, juniors and seniors. So what we've said to the community is we've canceled nothing at this point. We've postponed everything. And so depending on when we go back to school and what's left in the calendar, we will work to reschedule as many events as possible. But I want our community to know that we recognize the importance of these events. We recognize the fact that these are important life events for our students. And given the opportunity, the school district will reschedule those events for our students. We also understand that this is a tough time for everybody in our community, and staying home, our students, many of them have said that they like school better, and I'm happy about that. But it's tough on students, and it's tough on families when the kids are home and they're doing their learning from school, and mom and dad are trying to also do work from home. And I want our community to understand that if our students or a parent or the family as a whole is having difficulty, please reach out to our guidance counselors, send an email, make a phone call. They are there to help our families and provide them with resources within our community to help them. And they are willing and able and ready to help. So if anybody is struggling at this time, please make a call to our guidance counselors. They are there to help you. We are closing our school facilities. So we are now in the final stages of final cleaning, and then our maintenance crews will go in and they'll make sure that our buildings are in an unoccupied mode. And that means that our buildings will not have access unless something has to be fixed, something has to be repaired, or we have an emergency in it. The exception to those are the 6 sites where we will do food preparation and distribution, and the board office and our warehouse. And those will be the only operational sites, but they will be operational sites with skeletal crews. Only essential personnel who need to work will be in from this point forward. Everybody else will be on remote work, remote learning, and remote activities. I also want to let the community know that we put out a daily update Monday through Friday. That daily update includes a lot of new material every day at the top of the letter, and then as you work your way down the letter, you'll see some repeated items. And we think those repeated items are those really important items that really need a day or 2 or 3 to be on that update. But we provide that update every day. We put it out on social media, and we also post it on our website. So if you don't have social media, check our website every day by 5 p.m. It is up there. It will pop up as an update, as an important message on our website. Just click on the new update. It'll take you to our coronavirus update page, and every update that we have posted in the school district is available for our staff. And then finally, we talk a little bit about the fact that it can be tough for our students, our staff, and our community. We want to keep the morale up. So this week we have instituted Spirit Week. And Monday was Favorite Hat Day. Tuesday was School Spirit Day. Today is Wacky Socks Day. And I just want to let the community know that I asked the mayor to wear some wacky socks, and I can tell you that he did. And later on today, we will post it on social media, and I want to thank you for joining us in that. We appreciate that. Tomorrow is Favorite Book Day, and Friday is Friendly Friday. Post a message of kindness. And when you post your pictures, we're asking everybody to post on social media and use the hashtag HTSD as Spirit. We want to raise the spirits of our community, and one of the ways of doing that is doing Spirit Day. On Monday, we had well over 200 people participate. On Tuesday, well over that number. And Wednesday this morning when I got up, there were dozens of postings of wacky socks. And this is just a way for us to stay as a community, come together. It's exciting to see what our kids are doing, our faculty, our staff, our administrators are doing. So I appreciate you joining in on that.
Happy to, and thanks for letting me know about it. I picked out the wackiest pair I have.
Got it.
So thanks, Dr. Rocco. One thing you mentioned how you're closing the buildings except the ones for food distribution.
Yes.
Is there a food distribution next week as well, or is it not till after spring break again?
It's not till after spring break. Our food distribution yesterday was for 2 weeks.
Gotcha. Perfect. Thank you very much.
And can I make one other
Of course.
comment when we talk about school closing? I just want to remind the community that if you are on our school facilities, 2 things. One, please practice social distancing. Stay away from each other. The other thing is, please keep your eyes on our buildings. You are our eyes and ears at this point. If you see something around our buildings that doesn't seem right, if you see a problem, if you see it as an emergency, please notify the police department. Otherwise, please call the board office. And we appreciate you keeping an eye on our school facilities while they're closed.
And along with that, again, we talk all the time, the township has closed its playground equipment because obviously those surfaces, a lot of kids could be touching them. One kid could pass it to another that way. So if you're out on the school facility, the same thing would apply to the playgrounds on the school facilities as well. Please stay off of those because that helps us slow the spread of the coronavirus here in town. So thanks, Dr. Rocco.
Thank you, Mayor.
So good morning, Kathy.
Good morning, Mayor.
If you can start, I know we've talked a lot and we've provided updates like the school board has on things, but if you can just start by reminding people about some of the prevention steps they can be taking and some of the signs and symptoms they should be looking out for.
Sure. Good morning, and thank you both for allowing me to be part of our education for our community today on COVID-19. Just to remind our residents that the symptoms of COVID-19 are fever, cough, and hopefully not shortness of breath, but that is certainly a symptom for those who can contract the virus. We want to make sure that you have every prevention idea on how to help yourself come in contact with the virus, and that would be certainly social distancing, keeping your distance from people, and I want to thank you both today. We are definitely adhering to social distancing in our conference this morning. I'd also like to remind our public that we do need to wash our hands. The 20-second rule, washing your hands with soap and water is fine. That is the preferred method. If you cannot get to soap and water, then feel free to use one of the alcohol-based products that we wash our hands with when we can't get to soap and water. In addition to that, we want to make sure that those who are sick stay home. If you are sick with signs and symptoms, contact your primary care provider for guidance and try to keep yourself away from your family members and household contacts should you have that particular cough or signs or symptoms that we're talking about today.
So Kathy, if somebody starts developing the signs or symptoms, what should they do next at that point?
Well, if you start to develop the signs and symptoms of COVID-19, call your primary care provider for their guidance. Not everyone is going to be tested for COVID-19. Those with mild symptoms basically stay home and self-treat and try to isolate themselves from their family members.
So Kathy, one of the questions we've got from people is, what if they think a coworker is sick or may be sick? What do they do at that point?
Well, often we may hear someone cough, maybe allergies, as we were just discussing a few moments ago. But if you do really believe someone has the symptoms of COVID-19, you want to keep your distance. You want to continue to wash your hands. You don't want to touch the same surfaces. And if they should get tested and become a positive COVID-19 case, and you've had that direct contact that greater than 2 minutes and less than 6 feet, 10 minutes, I'm sorry, greater than 10 minutes and less than 6 feet, we do want to remind them that they could possibly be a direct contact. With that being said, we'd ask them to go home, self-quarantine and isolate for 14 days, making sure that they monitor their signs and symptoms as well.
Kathy, what's the 211 number that we've been seeing information about?
The 211 number is a number that they can call to get information. The general public can get information on COVID-19. There's also the 1-800 number, which is 1-800-962-1253, or the 211 number in the state.
And we've talked a little bit about testing. So the state has recently announced, and some of you may have seen it on the news, Bergen County has a drive-through testing center up at Bergen County Community College. Monmouth County at the PNC Bank Arts Center has a drive-through testing facility. The key with those is you need already to have signs and symptoms. Otherwise, you'll be turned away from those facilities. And those facilities, they are first come, first serve, and they fill up very quickly. We've been working with the county and the county executive to try to get a facility here in Monmouth County for drive-through testing. The problem we're currently having, and I know the county's working around the clock to try to fix it, is tests. We don't have enough tests to be able to open up a drive-through facility here in Mercer County. But I do want to thank the county. I do want to thank the county executive for putting in the legwork to have everything essentially ready to go so that once we have those tests, they'll be able to, in a matter of probably 2 days or so, get a drive-through testing center up and running, get it staffed, get it secured through law enforcement, and make sure we're ready to go. So I do want to let people know that we are working on trying to get a drive-through testing facility here in Mercer County, but due to the limited amount of tests, it's so far an uphill battle. But I do want to just let everybody know that in regards to tests. Kathy, in terms of people have heard about potentially new drugs that might be helping with signs or symptoms or being cures, is there any definitive guidance out yet on that from the CDC?
Unfortunately, there is not. There is no USA FDA-approved medications for the treatment of those individuals with the positive COVID-19.
And we're getting that information from the CDC?
That is correct.
Okay. In terms of planning events, if somebody's planning a wedding or a baby shower, either in April, May, do we have any guidance for them at this time, where we're going to be time-wise?
Well, as you know, this is a fluid situation, and we do not know where the numbers are going to take us. But at this time, they are recommending that all events with a social gathering be canceled in order to promote social distancing at this point.
And so you can cancel it, or obviously, for many people, we'll postpone those things. Again, as you said, this is a fluid situation, and
Yes.
We hope it goes away sooner rather than later. But we wanted to make sure you're all aware of the timing aspect of this, and we just don't have clear timelines. So for the people who've called asking, what do I do about my baby shower? What do I do about my wedding? Unfortunately, we just don't have good answers for you right now. So thanks, Kathy, for the update. One of the concerns I know we have as a township, and I know the school board has as well, is the stress that this change in circumstances and the virus is causing people. Any advice for people who may be feeling stress or anxiety?
Sure, it's perfectly normal to feel the stress and anxiety, especially when you're isolated at home. We deal with our senior citizens who do live alone, and many of them are now forced to stay in their homes, so it can be very anxiety-producing. There is a mental health hotline that the state has. It's called a Warm Line, and it's available 24 hours a day, and it does have language access capabilities for multi-language. That number is 1-877-294-4357. And we suggest that anyone who's feeling that anxiety call this number, and there will be someone there to talk with them and try to help them alleviate some of their fears.
Can you give that number again?
1-877-294-4357.
Dr. Rock, I know you talked a little bit before about guidance counselors. So how's the school district handling parents or kids who might be exhibiting signs of stress or anxiety with this?
We're doing two things right now. The guidance counselor is the point of contact for our families. Any issues that they're experiencing at home with their child or even their family as a whole, please give us a call. The guidance counselor will work with them to find resources. The other thing, every day in our daily update, we're providing a social emotional tip, things that parents can do at home, things that parents can work with their children, how to question them, how to get information about what's bothering their children in a way that opens the dialogue between parent and child, because sometimes children won't share what's bothering them, but as a parent, we know that they're being bothered by something. We're also providing some snippets from research articles on how to help children in tough times, and we'll continue to do that as long as we're sending updates and as long as we're in a remote learning mode, because we want our parents to have as many resources as possible. Some days are going to be really positive, exciting days, and the kids are up and ready to go for learning, and some days kids might not necessarily want to do that, and it's a good time to talk with their children about how they're feeling, and acknowledge their feelings, because like everybody, they might be smaller and younger and not have the experience, but they recognize what's happening. The other thing is, one of the recommendations that's coming down is turn the news off, right? When our children are in the room, we should be turning the news off and putting something else on if we're putting TV on. I know there's no sports on and things like that, but there are other programming that you can watch with your children, and children pick up the background noise of what's happening with the news. So that's been a recommendation we've also made. But we'll be providing tips daily. Our guidance counselors are available for our community. We do have social workers that are making phone calls also out to the family. And I encourage our families, whether it's an issue with a family member, yourself, or your student struggling, or it's an academic issue, start with a phone call to the guidance counselor or the teacher, especially if it's academic. And if you need to get more answers, you can always go to your school principal too, and they're there to help.
And I know in my house, I've had Bravo on a lot more just to not be inundated with the news. So I've been watching a lot more Bravo with my wife lately to get away from that. I know one of the things you all are probably stressful about or have anxiety about is your jobs or your income. Yesterday, the governor put out a new EO, which expanded the essential retail businesses to include mobile phone shops. I'm sure many of you are making far more phone calls to loved ones, to friends, to teachers and guidance counselors, and so I applaud the governor for opening that up, because we want to make sure people stay in contact and have those communication tools, specifically your phones, to be able to stay in contact with friends and loved ones. It also opened up bicycle shops for repair only. I took a ride around town yesterday through Veterans Park and Saying Gardens and all around different neighborhoods, and did see a lot of people riding their bikes, so we want to make sure people are outside exercising. That's another way to reduce stress. Obviously, make sure you're complying with the social or physical distancing aspect of that. But again, we want to make sure if you're riding your bike, or your bike may be coming out for the first time this season and needs a repair, that there's a place to take it to. And so those places of business will now be open to you as well. And again, if you're out in our parks, whether you're riding a bike, whether you're running, whether you're just walking with your dog or friends and family, do your best to, again, keep that social distancing. Obviously, if it's somebody you're already living with, there's less of a need to do it as you're walking. But as you're walking past people, again, just everybody be respectful of everybody. Try to keep that 6 feet distance, and it'll really help out. The other essential business that the governor opened was nurseries and garden centers. I know many of you are out doing more yard work as it gets warmer. That's a great thing. And so the nurseries and garden centers are open air facilities generally. And so I guess the guidance was that those would be less prone to having the spread of the coronavirus. So there's plenty of activities for you to do alone, for you to do with family members or your kids, to just be outside. Maybe not today. Right now, as we're taping this, it's raining outside, so that might not be the best time to do it. But as we get warmer here, there's going to be plenty of time to do things outside, and we want to encourage you to do so, again, making sure you're practicing those social and physical distancing guidelines. Again, on the job front, if you don't work in one of those facilities that's now a essential retail business, or some of the other businesses that have been deemed essential, there's many businesses that are looking for workers. Those essential businesses like ShopRite, like Amazon, and the like, they are working overtime to be able to get people the supplies they need, the food they need to be able to weather this storm. And so if you're currently out of work and you're looking for some work to do, we send out as part of our daily updates from the town some of those links to the Department of Labor or some other job sites. So please reach out to us and we can get you some of that information. That information is also available on the state's COVID website as well as some of those businesses that are looking for jobs. I'd also like to thank our people down in DC. I got the notification over last night that they're passing, or it looks like they should shortly be passing, a $2 trillion stimulus plan that the Senate, Congress, and the President seem to all agree on. That's going to provide enhanced unemployment insurance. It's going to provide financing for small and large businesses. It's going to be providing money for the state to help in our state budget situation. So all that stuff, as we get the details, we'll be putting out information there. But if you're stressed because you don't have a job, that's totally understandable. But no, people are working to get you the resources that you need during this difficult time. And together, again, we're going to get through all this. So, Kathy, one of the other big questions we've been getting in town is I've had direct contact with a direct contact. What do you do in that situation?
Well, a direct contact to a positive COVID-19 individual is the one who self-isolates. But if I've had contact with you, who had contact with someone else, I have no need to worry at this point. I just monitor my signs and symptoms like I would with any other type of virus.
Any other words of wisdom or advice for our residents who are going to be watching this video?
Well, first and foremost, I'd like to thank you both for having the opportunity to be here today. I'd especially like to thank the members of our health department who have been working diligently 24/7 for several weeks and will continue as we surge to do that as well, to protect our residents and to assist us in educating us on COVID-19. Most important for our community is to practice our public health recommendations, which are following good respiratory hygiene, cough in your elbow and not on your hands. Cover your coughs and your sneezes. Wash your hands as much as possible. Don't touch things and then touch your mouth. That's how the germs are spread, by touching a virus, touching your mouth, wiping your eyes, that type of thing. Use that soap and water-based product. If you cannot get to that, then use an alcohol-based sanitizer. Stay home, stay in your environment, enjoy your home, appreciate what you have, continue to socialize with your family, call your friends on the phone. I know we're going to work together with getting our students and our seniors in an intergenerational connection with some types of pen pal type of thing, which is great for both. I'd also like to remind people that we can get through this. We just need to do it together, following the guidance of the CDC, our federal, state, and our local leaders like you. So thank you very much.
Thank you, Kathy. Any final words, Dr. Rocco?
Sure. Kathy, I want to thank you for all the information you're providing every time we're here and in between these videos that we shoot. So thank you very much, and to everybody in your department who's working around the clock. Mayor, as I've said many times, thank you for your collaboration. It is constant. Every day we talk, multiple times a day sometimes, and I thank you and the entire township for all the work that you're doing. My final thoughts on this, as I've said a couple of times, I want to say thank you to the faculty and staff of our school district. You have risen to the occasion. I've said it a number of times. I want to say it again. I want to say thank you for all the hard work that you have done over the last 2 weeks. We have done incredible things together, collaborating together, and I thank you for that. We would not have been able to do it unless everybody pitched in and everybody did. To the school school community and to the community at large, we will get through this. We absolutely will get through this together. I look forward to working with everybody as we move forward day after day, week after week, but we will be here to support each other. And again, I thank the mayor, I thank Kathy, and everybody that's making this a very informational session and helping each other out. So thank you very much.
Thanks, Dr. Rocco. So I first want to thank you, the residents of Hamilton. As I said yesterday, I got a chance to drive around our parks, drive through a bunch of our neighborhoods, and everybody I stopped to talk to at a distance of 6 feet was upbeat and encouraging, and really knew that we were going to get through this all together. That there was going to be some self-sacrifice, there was going to be some inconvenience, but just like every other storm our country has faced, we've gotten through it because we've worked together to get through it. So I, again, just want to thank you, all the residents, for having that upbeat attitude as we go through this situation together, because that's what we need to get through it. I also want to thank Dr. Rocco and the school district for having us here today and providing us an opportunity to reach all of you in a different manner. We're constantly trying to think of new ways to reach all of you, to provide you the information that we have, the latest updates, so that you know what's going on here in town. And so I really appreciate you inviting us here to your building today and hosting us here, and for the true partnership and the true friendship between the township and the school district. Because like anything else, you can't get through it alone. You got to have friends that are there to help you. To our employees, to Kathy and her health department, but all our employees in town, all of you have stepped up. All of you have been flexible. All of you have been inspiring and encouraging, just like our residents, in getting through this. These are uncharted waters. These are unprecedented times, and you've approached the situation with class, with honor, and a steadfast resolve to get the job done, to make sure our township continues to run, continues to operate, and continues to serve the residents here in the town. So again, I want to thank all of you. To our, again, residents, I understand how stressful this may be with the constant barrage of information. We are here to help you get through it. We are here to provide you the information that we can to help all of us get through this together. We'll be continuing to explore new opportunities to reach you with different methods of communication, so that there's a constant stream of communication from the township and obviously from the school district as well to all of you. What I would say as my final words is continue to live your lives practicing the guidance that we all have become very used to at this point. Go for a walk, even if it's just around your neighborhood. It's so important to just be able to get out of your house, out of your apartment, and just be able to get some fresh air and just get out of the constant barrage of information you get from the news. That's, I think, so important, not only to your physical health, but to your mental health. As I think everybody else said, call friends, call family, call your loved ones. Just check in on people, even if you're not saying, hey, I'm calling to check in on you. We all need to be there for each other, and that's so important at this time. I want to thank, again, our elected leaders at different levels of government. The state, I know, is continually looking for what they can do to help us get through this, and our federal government as well is continually to move things forward to make this a little easier on all of us. We don't know when this storm will pass, but we know that it will pass, and together we'll all get through it. So again, thank you very much for your time today. We hope you enjoyed these videos. Continue to provide us feedback, and we'll get the information to you. So thank you very much.